Have you noticed that your legs just aren't as strong as they used to be? Maybe you found it harder to stand up from a chair, climb the stairs, or even walk for more than a few minutes without feeling tired, stiff, or unsteady. If that sounds familiar, please know this. You're not alone, and more importantly, you're not stuck this way forever. Many seniors experience a gradual loss of leg strength as they get older, and while it might feel like a natural part of aging, there's actually a lot more going on inside your body. Muscle loss, poor circulation, nerve damage, vitamin deficiencies, all these silent factors can quietly chip away at your ability to move, stand, and walk with confidence. But here's the hopeful news. With the right nutritional support, especially the right vitamins, many older adults are now experiencing a dramatic return of leg strength, sometimes in just a matter of days. Yes, you read that right. Days. New science is showing that certain vitamins, when taken consistently and correctly, can kickstart the body's natural ability to build muscle, improve nerve function, and restore healthy circulation, especially in the legs. The result? Seniors are feeling stronger, walking better, and getting back to doing the things they love, without pain, fear, or fatigue holding them back. In today's video, we'll walk you through three essential vitamins that have been shown to help restore leg strength quickly and naturally. You'll learn what they are, how they work, the best foods and supplements to get them from, and how to start feeling the results fast, often in less than 10 days. So if you're over 60 and feeling the weight of weak legs slowing you down, this video is for you. Let's explore the power of vitamins and give your legs and your life a brand new boost. 1. Vitamin D. Let's start with a vitamin that is often underestimated but absolutely vital when it comes to restoring leg strength. Vitamin D, also known as the sunshine vitamin. For seniors, especially those over the age of 60, vitamin D is not just important, it is essential. This powerful nutrient plays a central role in maintaining healthy bones and muscles, particularly the large muscles of the thighs and calves that support your every step. The problem is, as we age, our body's ability to produce and absorb vitamin D decreases significantly. Combine that with spending more time indoors, covering up when we go out, or using sunscreen, and the result is a silent, widespread deficiency that weakens muscles, causes fatigue, and makes daily movement harder than it should be. Most people don't realize that a lack of vitamin D can directly cause muscle weakness and pain, particularly in the lower limbs. Seniors who are deficient in vitamin D often experience trouble standing up from a seated position, climbing stairs, or even maintaining balance, and may not realize that this decline isn't just old age, but a simple nutrient deficiency. What makes vitamin D even more powerful is how quickly it can start improving leg strength once your levels are replenished. Studies have shown that older adults with low vitamin D levels who begin taking supplements can see noticeable improvements in muscle performance, balance, and lower body strength in as little as 7 to 10 days. That's because vitamin D acts like a key that unlocks your muscle cells, allowing them to function properly, regenerate faster, and respond better to physical movement. Without it, your muscles become sluggish, tired, and weak, no matter how much you try to exercise or eat healthy. And here's something many don't know. Vitamin D also supports the nerves that control your legs. So if you're feeling not just weak, but also unstable or wobbly, low vitamin D could be part of the problem. So, how can you make sure you're getting enough? While sunlight is the best natural source, just 15 to 20 minutes a few times a week on your arms or face can help. Many seniors still don't produce enough due to reduced skin efficiency or less time outdoors. That's why food and supplements become essential. Foods like salmon, mackerel, sardines, fortified milk, eggs, and mushrooms exposed to sunlight are all good sources, but it's often difficult to get adequate amounts through diet alone. In fact, experts estimate that nearly 60 to 80% of seniors have insufficient levels of vitamin D, even those who eat reasonably well. That's where supplements come in. Most doctors recommend 800 to 2000 IU of vitamin D3 daily for seniors, depending on your current levels and health conditions. It's best taken with a meal that contains healthy fat, like olive oil, nuts, or avocado, because vitamin D is fat soluble and needs dietary fat for proper absorption. Another tip: make sure you're getting enough magnesium alongside your vitamin D since magnesium helps activate it in the body. Foods like spinach, almonds, and beans are excellent sources. If you're not sure whether you're deficient, ask your doctor for a simple blood test. It's quick, easy, and could give you the answers your legs have been waiting for. Remember, sometimes weakness doesn't mean your body is broken, it just means it's undernourished. And vitamin D might be the exact spark your muscles need to come back to life. For so many seniors, this one vitamin is not just helping them walk better, it's helping them reclaim independence, mobility, and confidence with every step. 2. Vitamin B12. Now that we've covered the muscle strengthening power of vitamin D, it's time to talk about a different but equally vital player in the restoration of leg strength: vitamin B12, the vitamin responsible for keeping your nerves healthy and strong. If you've been feeling tingling, numbness, heaviness, or a strange sense of imbalance in your legs, the problem may not lie in your muscles at all, but in your nerves. And vitamin B12 is one of the most crucial nutrients for keeping those nerves working correctly. You see, your legs don't move on their own. Every step you take, every time you rise from a chair, your brain sends signals down through your spinal cord and into your leg muscles. This entire communication system depends on the health of your nerves. And vitamin B12 is the nutrient that keeps those nerve pathways well insulated and responsive. But here's the catch: after the age of 60, your ability to absorb vitamin B12 drops significantly. It's not always because of poor diet, it's often because the stomach produces less acid with age, which is needed to extract B12 from food. And if you take medications for acid reflux, diabetes, like metformin, or certain antibiotics, they can further block B12 absorption without you even realizing it. A deficiency in vitamin B12 can creep up slowly and silently, showing up as fatigue, poor memory, pins and needle sensations in the legs or feet, weakness, balance issues, and even depression. The most alarming part: B12 deficiency can mimic serious neurological conditions, and in some cases has led seniors to be misdiagnosed with dementia or Parkinson's disease. But the amazing news is, once detected, a B12 deficiency can be corrected rapidly, often within days or weeks. And many people feel significant improvements in their leg strength, stability, and coordination. It's like plugging your nervous system back into a power source. For seniors who have been struggling with unexplained weakness or odd sensations in the legs, restoring vitamin B12 levels has been life changing. So, how do you get more B12? Naturally, it's found in animal based foods like liver, beef, chicken, eggs, milk, yogurt, cheese, and fish, especially salmon and tuna. But if your absorption is poor or you follow a mostly plant based diet, food alone may not be enough. That's why many doctors recommend sublingual B12 supplements, which are drops or tablets that dissolve under the tongue for faster absorption. In more severe cases, B12 injections are used to rapidly replenish stores. The standard daily recommendation is just 2.4 micrograms, but seniors often need higher doses initially to correct a deficiency. The great part is vitamin B12 is very safe, even at higher doses, because your body simply excretes the excess. If your legs feel tired, unstable, or strange, like they don't respond as quickly as they should, it's worth getting your B12 levels tested. A simple blood test can tell you everything, and if you're low, don't wait. Restoring B12 could be the missing link between weakness and strength, between fear and freedom. It doesn't just help your legs, it helps your brain, your memory, your mood, and your entire nervous system feel more connected, awake, and alive. Thousands of seniors have regained their footing just by correcting this one deficiency. You deserve to feel steady, strong, and secure. And vitamin B12 can help you get there faster than you think. 3. Magnesium. Now let's talk about one of the most overlooked yet essential vitamins. Well, technically a mineral, but often called nature's calming vitamin because of its powerful role in muscle function, nerve health, and energy production. That's right, we're talking about magnesium, a critical nutrient that can make the difference between weak, cramping legs and legs that feel stable, strong, and capable. If you've ever experienced muscle cramps in your calves, restless legs at night, twitching, spasms, or general heaviness and fatigue in your lower limbs, there's a very real chance you're lacking magnesium. The irony is, many seniors are, yet they don't know it, because magnesium deficiency is often missed in routine blood tests, and the symptoms can be brushed off as just aging. But here's the truth: magnesium is vital for muscle contraction and relaxation. Without it, your muscles can stiffen, fatigue faster, and fail to recover. It also plays a huge role in regulating nerve impulses and ensuring your muscles receive clear signals from your brain. So, when your magnesium levels drop, your legs don't just feel weak, they may feel confused, heavy, or constantly tense. You might notice it when walking, climbing stairs, or simply trying to get up after sitting for a while. But the incredible part is when magnesium is replenished, many of these symptoms dramatically improve, sometimes within just a few days. That's how fast your body responds when it's finally getting what it needs. And it's not just about cramps or fatigue. Magnesium also works at the cellular level to help your body create energy from food, which means your muscles get the fuel they need to function. No fuel, no power. That's why seniors who are low in magnesium often feel drained, unsteady, and too tired to move their legs much, even if their heart and mind are willing. Unfortunately, aging makes it harder to absorb magnesium from food, and many common medications, like diuretics, blood pressure pills, and acid blockers, flush magnesium out of the body, making deficiency more likely the older we get. But here's the good news: magnesium is found in many delicious, healthy foods like spinach, pumpkin seeds, almonds, black beans, dark chocolate, avocados, bananas, and whole grains. However, because it can be difficult to get the full amount from food alone, especially for seniors with dietary restrictions or absorption issues, magnesium supplements can be a game changer. There are many types available, but one of the best forms for muscle relaxation and absorption is magnesium glycinate or magnesium citrate. These are gentle on the stomach and quickly get into your bloodstream to do their work. Most seniors benefit from 200 to 400 milligrams daily, but it's always smart to start low and increase gradually under a doctor's guidance. Here's something else to keep in mind: magnesium works in harmony with vitamin D and calcium. So, if you're already taking those for bone and muscle health, magnesium helps your body actually use them more effectively. It's the missing puzzle piece in many seniors' nutrition routines. And once it's added back in, the results can be stunning: better sleep, fewer cramps, more energy, and yes, stronger, more relaxed, and more reliable legs. If your legs often feel tight, twitchy, heavy, or just not quite right, don't ignore it. It could be your body's quiet cry for more magnesium. Give your muscles the relief they deserve, and your legs the freedom to move like they once did. Sometimes the solution isn't complicated, it's simply getting back to balance. And magnesium may just be the key to doing exactly that. If you've made it this far, it means you care deeply about your health. And more importantly, your independence. And that's something to be proud of. Weak legs, wobbly steps, and unexplained fatigue are not just signs of aging. They're often signs of missing nutrition. But the good news is, with just a few small changes, like adding vitamin D, B12, and magnesium into your daily routine, you can start to feel stronger, steadier, and more energized again. So here's what you can do right now: talk to your doctor about testing your vitamin levels. Add these leg strengthening nutrients through food or safe supplements. And most importantly, listen to your body. It's never too late to feel better. If you found this video helpful, please give it a thumbs up, share it with someone you care about, and subscribe to our channel for more trusted tips on healthy aging, mobility, and natural wellness. You deserve to move with confidence. You deserve to feel strong again. And with the right support, you absolutely can. We're here to help you every step of the way. Thank you for watching and take care of yourself because your best days aren't behind you, they're just ahead.